Hi everyone, welcome to my presentation. I'll be presenting on John Harris and the distinction between treatment and enhancement. So the prompt that I have chosen is to critically evaluate Harris's full argument. First, explain the argument. Second, criticize the premise in the argument by generating a counter-argument of your own against the premise and demonstrate your philosophical skills. The thesis I have chosen or I have made is Harris's moral distinction of treatment and enhancement is unclear, and the framework of enhancement is limited. So some key terms I have shown is right here. Due to time, feel that you could read it, but the importance here that is at stake is that I understand that Harris's argument demonstrates there's no moral distinction between treatment and enhancement, and that there is an attempt to cure dysfunction and attempts to enhance function where enhancement protects life or health. However, I am concerned that due to his lack of explanation of why forms of enhancement is not included, it could cause unclarity to an individual to understand his argument and impact his utilitarian perspective. My goal is to argue about how Harris's argument undermines different forms of enhancement due to the failures of his own distinction of enhancement. For my prompt, I was given two premises. The first premise is if utilitarianism is true, then the forms of eugenics are morally obligatory. The second is utilitarianism is true, therefore some forms of eugenics are morally obligatory. An example of this would be using Casey's case of him giving up a healthy kidney to save a life. In this aspect, we're using utilitarian perspective of him creating a greater good because he knows that it increased quality of life, him giving up his kidney knowing that it will greater affect someone who is in need. The second premise I have chosen or have given, and I will be later arguing against, is if there's no moral distinction between treatment and enhancement, then the second form of eugenics are morally obligatory. There is no such distinction. Therefore, some forms of eugenics are morally obligatory. For their explanation to this is that treatment is used as a form of improvement of quality of life, and that the same intentions are there to argue against enhancement because it also creates a better quality of life for an individual. However, Harrison is not saying that there is no distinction between the definitions of treatment and enhancement. It's obviously two different terms. However, the intention of them are the same. An example of this we could use is a vaccination. He sees this as an enhancement or a treatment, but in this case, we could use it as an enhancement. For example, getting a flu shot. Receiving a flu shot will increase the immunity for yourself that you're preventing contracting the flu, but also preventing everyone else from receiving it. You could say that as getting antibiotics for treating the flu. So it sort of has the same aspect of intentions that he was trying to get in this premise, as well as gene therapy. He is a support of gene therapy. Harris believes that being able to prevent the disease, that picking and choosing certain genes to prevent having it will improve the quality of life. So treatment and enhancement have the same intentions. However, I am here to criticize premise of number 2. There is no distinction between treatment versus enhancement, mainly because what is enhancement for protection of life or health? Harris, to further what Harris is explaining, I feel like his definition of enhancement is mainly revolved around form of increasing life expectancy because he uses an example for it is death postponing versus saving a life, that there is no difference. However, the quality of life isn't based on how long you live. Sackton has even talked about it. It's mainly based on how the person's over well-being, even with people with disabilities. It's not how long they live, even if they have a limitation. It's based on how overall they felt throughout the years they have lived. And so the difference between treating and versus enhancement, there is a distance because treatment has some sort of or moral obligation to treat someone in attempts to reach the baseline of health. That is what treatment is. However, it doesn't have the same moral obligation, and enhancement doesn't have the same moral obligation that treatment does. A doctor has a moral obligation to treat those who are in need of help versus enhancement. You don't need to treat someone who's at a baseline, who's already at baseline. You could help enhance it, yes, but it's not the same thing. Even with Harris, he believes that there is a distinction. He doesn't talk about cosmetic enhancements, which does undermine the idea. And I feel that the enhancement of protecting life or health starts to turn into some kind of gray area. He talks about the reason why he doesn't go further is because cosmetology will manipulate intelligence, that picking and choosing traits would not do good for what he's trying to argue. However, doesn't that seem the same thing as gene therapy? I feel like that's sort of undermines his argument of supporting gene therapy because doesn't therapy prevent disease? So, what are different enhancements? So, I use an example here of ADHD pills. Someone could get treatment for an ADHD pill, Adderall specifically, to make sure that they are focused and that their ADHD is under control. However, some people, like anybody who is a college student, not everybody, but in terms of anybody who wants to enhance their performances, may use ADHD pills to focus. And it sort of undermines the purpose of the distinction between treatment and enhancement, and that it's causing more harm than good. So as a treatment of using ADHD pill, you're trying to create a better fit group of anybody who has ADHD will be treated, and versus someone who's just using it mainly based on their, yes, I guess quality of life, but just in their situation. So I feel that human enhancement has unintended effects or benefits that could also harm or go against Harris's argument. Therefore, Harris's argument must be clear in his distinction between protect life or health, mainly because he doesn't go in depth of reasoning of different types of enhancements, whether it's like cosmetology or different types of gene therapy. He never further talks about that, and I feel that it really does create a weird draw the line where to go with this no moral distinction argument. Also, we also have to realize that any procedure or any medical use of drugs could be used as a way of harm, and that it could become a double-edged sword, which could hurt um, the intentions of treatment versus enhancement in Harris's argument, that in a way gene therapy is sort of used in a way of enhancement, that it could harm, there could cause harm, but rather than do good. Um, Again, cannot exclude other forms of enhancement because it weakens his argument. Therefore, there is a distinction between treatment versus enhancement. Again, thank you for listening to my presentation.